Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers podcast, and today we have another guest. And you might think that why would I have a guest on who really doesn't have any background in thyroid physiology or anything specifically in functional medicine? But when I was sent a request for Christopher to come on the podcast, I thought the topic that we're going to discuss is really important because I think we don't consider the impact of what I call emotional stress or psychological stress has on our health and our physiology, and can be the root of why we have chronic health conditions. So I thought it would be a great topic to discuss a little bit more in depth. And so on with me today is Christopher Maher, right? Did I got that close? I think I got it close.
Close enough.
So Christopher, thanks for coming on the Thyroid Answers podcast. Can you give us the listeners a little bit of background about who you are and why they should, listen to you? What makes you some type of an expert into stress and the impact stress has on our physiology?
Okay. Thank you for having me here first.
Sure.
Second, for the listeners, thank you for tuning in. My background is a bit unique in the sense that I had no desire, to understand stress from the inside out and the impact that it would have on me on a daily basis. I'm a former U.S. Navy SEAL, and you can imagine the stress load that I was under in that organization. And I also was a child of childhood trauma, all forms of trauma. My mother passed away when she was 29. She took her life. So she obviously was under an intense amount of stress and had mental wellness challenges, right? She was ballooning up to 300 pounds and then shifting down to about 120, 150. So she was yo-yoing intensely in her weight. Her father, my grandfather, he died of cirrhosis of the liver. My mother's Irish, and drinking is part of their culture and how they manage that stress. And so I chose negative stress management tools as well. In fact, when I was in the SEAL teams, I had no idea I was under stress, because the thing about stress loads is they creep in very slowly until one day you have a chronic symptom and you're like, well, how did I get here? Yesterday I didn't have this. How do I get out of this? And at the time, this is what, 1998, 1999, when it started to become very chronic for me, there actually weren't any answers, because this wasn't a conversation. The conversation you and I are having today, no one was having, right? And no one who had an MD medical degree besides Hans Selye from Hungary was willing to have this conversation, right? So we consider him to be the father of stress. So I had pain at every joint. And then I started losing my hearing. That was the first physiological challenge that I was having. I was already having the structural challenges. And then I was losing my vision. And this was all happening in my late 20s, okay? And then the next thing that was happening is I was having insomnia. And then I was waking up. When I would fall asleep, I would wake up 3, 4, 5, sometimes as many as 10 times a night to urinate. And then that bridged into having emotional challenges, right? High levels of anxiety, disconnection, a level of dishonesty with myself. I was pushing my body too hard and too fast, faster than it could recover. And it was giving me all intense signs, right? Red lights were flashing everywhere, and I was ignoring, because I had been indoctrinated since I was very young. I went to a privately well-endowed boarding school, and I basically grew up on a farm, right? And guess what? Farm work starts early. We're in the barn at 5:30 in the morning. 5:30 in the morning as a kid. All right. So I was used to waking up early, being under stress, not having a great night's sleep, being in a boarding school, never getting any private time to myself. Right. And so I had already developed these strategies in order to deal with life. So finally, one day, I bent the knee and I reached out for help. And I asked someone, and guess what? A buddy of mine that had been in the SEAL teams decided to come over to my house. He brought his yoga mat and he brought a juicer. And he made us, at the time, which was something that was delicious for him, tasted absolutely disgusting to me. Took me about 45 minutes to get mine down, right? Parsley, radish, carrot, apple, celery. And I was just like, yuck, this is not my bag right here. And at one point I realized, oh, this tastes good to him because he's healthy and fit. This tastes disgusting to me because I'm fit and toxic. And we don't talk about toxicity. We don't talk about cell death. We haven't had these conversations until recently. And so I was like a perfect storm of everything that you needed in order to start failing miserably. And then I had a car accident. And then a car accident drove the pain into the very center of my hip, and I could never get away from it. And so then I had to start investigating reality to find if there was anyone out there that could help me.
Because you were getting treatment for pain, but it wasn't helping.
Sufficient. It wasn't sufficient. Look, I needed to go a mile. These people were taking me an inch. And in retrospect, at the time, was I grateful for that inch? Because when you're in unrelenting pain, if you get a reprieve from it for 10 minutes, 15 minutes, an hour or two, or a half a day, you're grateful.
Mm-hmm.
Okay. You're great. So anybody who's listening, if you've had pain in your body, you know exactly what I'm talking about. So at the time, I was grateful. But then it would start creeping back in. And then I would dive into the next system. So the things that I got into acupuncture, acupressure, yoga, hot yoga, Feldenkrais, the Egoscue method, Rolfing, Heller work, like everything and anything that was holistic. And I looked under every stone and every fallen tree in the forest to see if there was something better. And I kept asking myself, should I keep going, right? Should I invest more time, more energy, more resources with this tiny bit of result? But I knew that there was someone on the planet that had to know more. And fortunate for me, I had a guy that I went to boarding school. His name is Mark Elijah. We had spent 2 weeks together hanging out, and he sent me an email. He said, look, I saw this guy in Good Morning America. He's got 5 stretches that'll change your life. And I thought to myself, Mark, why don't you go change your life? Because I was in that state that we were talking about earlier before we started the podcast. I was in the protective mode. And when you're locked into the protective mode, you're essentially trapped in fight or flight. So that inappropriate stress state that I was locked into is what was causing all of structural, physiological, systemic, biological, and sense organ dysfunction. And the moment.
So for the listener, let me interrupt you for a second. So somebody on the other end of this is going, come on, Christopher, you're telling me my gut issues, my thyroid issues, my chronic pain, these other things may be the result of something psychological, possibly, but because I feel real pain. You're telling me what I feel is not, it hurts right here. And you're telling me that it could be caused by something else, right? And for a lot of people, that may be a hard thing to get to because that's not the world they grew up in. Pain is caused by if you got hip pain, it's caused by pain in your hip, right? If you have back pain, it's caused by pain in your back. So I'm going to let you finish, but I just want to ask, were you always the person who had a holistic bent on this? Like, oh, I'm going to try something natural, because a lot of people, especially in the world that you were in and came from, the solution often is not, hey, let's do some yoga and Pilates and stretching and muscle work. It's, hey, let me give you a painkiller so this knocks this down and let's keep going. We got work to do. And that becomes the strategy. Did you find yourself ever in that model, or were you always more the kind of more natural mindset?
Initially, because in SEAL training, we have a doc that's devoted to us. I was in a Western medical model, right? He was a great guy. He and I got along really well, and I was pounding ibuprofen, right? That was my solution. And there's a point where that no longer works, right? There's a point where there's not, you're going to ruin your stomach, right? So I was taking ibuprofen, and then I would have a stomach ache. And if I got to choose between having a stomach ache and not eating or dealing with some knee pain, I'll deal with the knee pain, right? Because just a part of me says, yeah, your organs are more important than your joints. Okay, if I prioritize things. And so I was not that guy, to answer your question. I was the guy that just wanted a quick solution. I didn't want to investigate. I wasn't somebody who woke up in the morning desiring to help other people, in the sense that I want to devote my life to helping people understand that the inappropriate stress state that they're locked into is the thing that's causing their symptom to be expressing itself into some level of pain, whether that's emotional pain, whether that's psychological pain, whether that's energetic pain, or whether that's physiological or structural pain.
Or it could manifest itself as chronic inflammation, immune upregulation, disrupted gut physiology. And so that's important, because a lot of times people think, especially in our world, they're thinking, if I've got hypothyroidism, what's the shiny object of the day? Oh, you must have Epstein-Barr virus. It must be mold toxicity. It must be this external thing that you're fighting, and we have to find it and kill it and get rid of it. And it's sometimes a hard concept for people to realize that what might actually be maintaining my chronic health problem, my chronic illness, regardless of what it is what's going on in the conscious or subconscious mind. What's going on in there that's driving this cell stress and cell danger type physiology that becomes more chronic. And the body's not broken from my perspective. It's just adapting. Like, okay, if I'm still in danger, then this is the way I need to operate. Does that make sense?
This is the way that I need to deal with this, right? And so, look, your psyche, and from my experience, people's childhoods determine what they're going to experience as symptoms later on in their life. And if they refuse to investigate, right, and if they refuse to look at themselves as a whole being, who am I physically, who am I energetically, who am I emotionally, who am I psychologically, and who am I systemically, then you're going to miss your opportunity to create a successful pattern interrupt. Because sometimes it's as simple as, like, you got to repair your relationship with your dad. What do you mean I got to repair my relationship with my dad? He was an alcoholic. He was mean. He regularly hit my mother in front of me. But you got to understand that all that blocked you into an inappropriate stress state. And if you don't address the thing that locked you into the inappropriate stress state, you're going to be chasing symptoms the rest of your life.
So I would say yes and no to that, right? Because if somebody had a traumatic experience, they may have a great life because so let's do this before we get there. So you wound up finding out you were struggling. You went and then did training and try and take care of yourself? Is that how you became, how would you identify yourself at this point?
So what I did is I basically got really lucky, right? I prayed a lot, and I kept asking for the next thing. And so as I removed tension and stress from my body, what happened is all of my symptoms disappeared overnight. Overnight, that quick, that fast. So I'm suffering. Now suddenly I'm not suffering. And I flew up to San Jose. The guy picked me up. He worked on me for 6 to 8 hours, and I woke up the next day and all the pain was gone.
So what does that mean? Because somebody's gonna
Yeah.
go
Okay,
like,
got
come on,
So what does that mean? So I use concentric and eccentric contractions to remove massive amount of tension and stress out of my fascia and out of my muscles. And that created what I would name a shift in my bone rotational relationships. And it gave me a major degree of relief, because now the rotations of my bones were all sitting in a completely different position. And now the discomfort, the swelling, the pain was gone.
Okay. So you had somebody do some muscle work on you,
some body
right?
work.
Okay.
Yeah.
So you did a bunch of body work before. So why was this body work different than the body work you've done in the past?
This is a great question. The reason why this was different is because I wasn't involved. Right? When I'm laying on a table and someone else is working on me versus this guy's pushing against me and I'm pushing against him, I'm engaged and I'm involved in the process. And as I'm involved, I can generate more force. So the challenge of what you have happening in the holistic community is that the levers generate very little force. Okay, with a little force, we know through scientific practice and study that little force creates a little change. No force creates no change. Medium force creates medium change. Maximal force creates maximal change. So I got to engage in eccentric contractions in hundreds of different positions. I could generate maximal force, and through his help, he could help me create maximal change.
Okay. And so you did some physical work.
Yeah.
And it changed. You're saying, hey, that changed my fascial and muscle and neuromuscular. It's changing the neural input.
1000%.
Right. So you're firing mechanoreceptors. You're kind of calming down nociception, and so you get a different input into the brain. And so for the listeners, one of the things that's important is your joints and your tissues have let's just say two kind of primary receptors. Mechanoreceptors, which fire and send signals to the brain to say, hey, my ankle's moving, this tissue, this muscle is moving, and that signal goes to the brain, so the brain then knows what that compensatory response or action should be. And then there's another type of neural receptor that's called a nociceptor, and that's I don't like to use pain receptor because it can be perceived differently, but it's let's say an irritating stimuli receptor. That one fires all the time. Yeah. Now, the more mechanoreceptor movement you have, the less perception of nociception. The less mechanoreceptor movement you have, the more nociception. Oh. Right? So are you familiar with those things?
I mean, I'm not familiar with it in that way, but I'm familiar with the experience of what you're talking about. It makes absolute sense.
So when you're getting that, when you have fascia that's tight and joints that don't move appropriately, you lose mechanoreception. And one of the things that then happens is you get more nociception perception. So think about that like the static on a radio. When everything is moving, you're getting a lot of mechanoreception. That's like having the radio station tuned in really precisely. Yep. There's static in the background. You just don't hear it because you're really tuned into the station. But when you lose the mechanoreceptor firing, then more of that static starts to occur, and it'd be like listening to your favorite station, but it's really hard to get it dialed in. So there's a lot of reception. It's choppy. You kind of miss the words of the songs. It's not clear. And that happens to the physiology. And then there's another impact that occurs as a result of that. My brain needs a certain amount of input, mechanoreceptor input, to function appropriately. And so if I can't get it through my normal joint movement, muscle firing, my brain can create it by tensing up more muscle tissue. So now you get more muscle tension, let's say in your neck, right? Hey, Christopher's got a bad hip. It's been injured. The muscle tissue tightens there. He gets more nociception coming in. It's painful. Now what happens is all the tissue around that's going to tighten. That fires some of that mechanoreceptors. And now the brain's like, okay, now I know how to move the hip. Now I know how to move things. The problem is now we've got this chronically tense muscle that now exhausts, becomes tired, becomes fatigued, becomes inflamed. We get this vicious cycle going on. So I think that's probably a big piece of what you guys were trying to accomplish with that eccentric, concentric is, hey, how can we, whether that was the thought process or not, is how can we activate the nervous system, these mechanoreceptors, and dampen down that nociception?
Yeah, and inform the brain, hey, listen, you can reduce the swelling. Right? You can, because, when you have pathogenic swelling and inflammation all over your body, the swelling in of itself is going to be pushing and informing all the nerve tissue around there that, hey, we need you to give more fluid so that we can save the joint, right? Because otherwise there's going to be so much friction. I look at things in terms of heat and temperature, electricity, and tension and stress, right? So if my body's job is to save itself, so if I'm creating a massive amount of friction at the joint level, it's going to release the fluid and create swelling for a very specific reason, which is to slow down the amount of friction that's happening, or all that soft tissue within the joint is going to be destroyed faster than I can rebuild it, right? And so when we went through our process, because we used big levers, right? The eccentric contraction is 30 to 50% stronger than a concentric contraction. So what does that mean? So if I can bench press 100 pounds at maximal force, I can lower 150 pounds with the same level of skill. So whenever you see like a big cat or even a small cat and a dog, what's the first thing they do when they get up from laying down?
A stretch.
They reach their paws forward, right? But they contract maximally. And while they're contracting maximally, they pull their hind legs backward, right? They pull their hips back in space. Well, what's that doing? That's creating an eccentric contraction, right? The muscles contracting maximally while moving simultaneously. And if you do that in very specific positions, it creates a very specific result. And it's repeatable, verifiable, and reliable. If you bring 100 people in who are suffering from the same ailment, elbow pain, and you remove a massive amount of tension from their biceps, a short head and a long head, and the triceps, guess what happens? They get up, they move their arm, and there's no more pain.
Oh, listen, I'm not arguing that point. I agree with it. We use those types of techniques.
This is an explanation for the listener who doesn't understand about receptors and mechanoreceptors and the things that you're talking about. I'm laying it down in layman's terms, so that the average human being who has some bit of a mechanical mind can begin to go, okay, yeah, that makes sense to me.
Yeah, right? there's a number of techniques that have this principle as the foundation, right? We see, I mean, one of the trigenics is a technique where we can use kind of stimulating these neuroreceptors to take somebody who's got, I can't even lift my arm or shoulder, and within a couple seconds you've got them, pain's gone. How did that occur? Well, because we just tripped that switch that is the nervous system, and now the nervous system is not firing and causing that chronic muscle tension, which creates imbalance and puts strain on the joint, and it's gone. You know, is it gone forever? Well, you got to work through that process because the nervous system has plasticity to it, so you have to untrain it. But let's get back to your story, and then let's talk about stress. We understand, we could get back to this technique maybe down the line, but so you get help with this. How do you go from soldier to, my guess is this is what you're doing now primarily, is helping others with this, with chronic, is it just chronic pain, or is it the impact of chronic stress?
Yeah, I mean, it's the impact of chronic stress. The end result of that is chronic pain, right? And when I say pain, there's different forms of pain. Some people, they deal with emotional pain. What would emotional pain be? Repression, right? Emotional disconnection, depression, narcissism, right? People deal with energetic pain, right? What does that mean? That means they have inconsistent energy, right? Some people suffer from exhaustion, and other people have physiological, they have structural discomfort, right? Knee, hip, back, neck, shoulder, wrist. That's where their opportunity is showing up. And in some people, they have psychological pain. They deal from debilitating fear and anxiety. And so the question is, how do you, for me, when the person arrives, they've pretty much gone down the trail of everything that gave them unsatisfactory relief from their chronic or intermittent states of dysfunction.
Okay.
And then I help teach them and help them remove that stress state, right? Because my focus is on the stress, I don't have to ever really put a lot of attention on the symptom. And I tell them, like, look, I'm not here to change your symptoms. I'm here to help you deal with your stress. And then I do a deep investigation.
Okay. So
right?
let's break down some definitions then. Okay.
Yeah. Okay.
So people are thinking stress, like emotional. I don't have emotional stress. Or are you talking about finances? Are you talking about physical? So define a couple terms for me if you feel comfortable doing that. Stress, strain, trauma. Because these three words all get kind of used interchangeably and they're different. So what's your definition of those terms?
Yeah, my definition of those terms is within a 24-hour period, everyone's body absorbs positive stress and negative stress. So eustress and distress. You have to subtract the positive stress from the distress, and then you're left over with what I call your daily accumulated stress load, right? And so positive stress is anything that you do to benefit your life, okay? Distress is anything that you do that is a negative. So for instance, let's say someone is, instead of running 30 minutes, they choose to run for 3 hours, right? So there's a point where there's diminishing returns. Now, every bit of that positive stress and negative stress that I do not recover from with my sleep is left over and gets piled into my lifetime accumulated stress load. So if I continue to do that day after day, week after week, month after month, I create consistent strain on my system. So stress is this tiny, tiny little thing that over time of continuing to behave, think, feel, and move and do things in the same way piles up into what I call your daily accumulated stress load. When your daily accumulated stress load gets high, it starts affecting your lifetime accumulated stress load. And now you're under constant strain of unresolved stress loads.
Okay. So
you have to have a high. So what I would think I call restore, repair, and recovery rate. When your restore, repair, and recovery rate is low, your levels of strain are very, very high. But when your restore, repair, and recovery rate is really high, guess what happens? Your strain and your stress loads, they're very low. And so the question is, what causes my restore, repair, and recovery rate to be low? It's your lifetime accumulated stress load. When it's high, it puts you under constant strain, a strain that your sleep is not sufficient enough to recover from. So you take Monday, Tuesday, Wednesday, and Thursday stress load into Friday. And if you do that again and again and again and again and again and again, I promise you, by the time you hit your late 30s, mid 40s, you're going to have some chronic symptom that you need to reach out and get help for. But the challenge is most people, not your listeners, but most people are in a category that I call stress ignorance. And when you're in stress ignorance, you think that, oh, I'm just getting old. Like if I talk to one of my aunts and she has little pain in her wrist, she's like, well, it just happens. I'm getting old, honey. And I'm like, no, chronically, yes, you are getting older, but your body's getting less efficient because you only sleep 3 hours a night.
Yeah. And I agree with a big part of what you said there. I think I use different vernacular in my discussion, but for the listener, I'm going to define those terms maybe a little bit differently, but maybe similar. Stress is the experience on the system.
Yep.
From my perspective. So it could be somebody yelling at you. It could be running. It could be whatever. That's the thing. Strain is the impact or the change it causes on the tissue. So that's the strain. So that's somebody yells at me. What's the strain on my system? Does my body need to adapt to it? Does it need to change to that? Trauma is the emotional or psychologic result or manifestation of that stress experience. That's kind of how I define them. Are you okay with those definitions?
Yeah, I mean, I'm okay with those definitions. The thing that I would add is I created a term called strauma.
Mm-hmm.
Right? Because what happens when you use the word trauma, most people relate that to, oh, I went over to my uncle's house. He was drunk and he kicked me in the back when I was walking out the door because he didn't like what I said, right? They relate trauma to a specific event, right? So I created a term called strauma, which is stress and strain plus time.
Okay.
So if you're under a sufficient and consistent level of stress over a long period of time, eventually one day, guess what happens? You end up with the same symptom that the person has that was raised in a household where their mother was yelling at them all the time, except it takes you a little bit longer to get there. Okay. And so there had to be a term for that because I couldn't find any when I researched. So I created a term called strauma, stress that's unresolved plus time that eventually causes a person to experience the same type of symptom, right? For instance, Mr. Johnson goes down, he's 55, he goes down to tie his shoe. He's getting ready to go to work. And guess what? He has a disc that slips out of position, and now he's stuck on the floor for 12 hours till someone comes and helps him. And now he's been in bed for 2 or 3 weeks. Same as the guy that was in a car accident, right? He was sitting at a stoplight. Somebody didn't brake. They were drunk and they ran into the back of him. And now he's stuck in bed for 2 to 3 hours. So there had to be a term created to be able to make a distinction because most humans only associate trauma with a very specific event. They don't relate trauma to something that eventually evolves over time. So I use a term I created called strauma. stress unresolved that creates strain over time, that creates a debilitating symptom.
Okay. Yeah, I think the key piece there is that the event, the same exact event in two different people, does not have to create trauma.
No.
Right? So one person gets hit by the car and they're like, hey, got hit by the car, do my rehab, I'm good. The other person, that incident changes, has a longer effect on their emotion and their psychology. How they interpret that situation has a negative impact, a more negative impact on their physiology.
Yeah, for sure.
That would be the trauma,
yeah,
right?
Yeah. I mean, well, yes. If the person, well, I mean, we're getting into a funny little area here. But if the person is locked into an inappropriate stress state for a very long time, when that car hits them, they're going to have more explosive symptoms because they're already locked into a stronger inappropriate stress state. So let's say you laid down every human being on the planet and we took every one of them through teaching, through testing. What you would find is that the average human being is 1.5 inches out. And what that means is their brain is electrically, one hemisphere is clearly turned off, right? But some people have at least some electrical function that's going in one hemisphere of the brain. And if we take them teaching through testing and then we pull them out of that inappropriate stress state, guess what happens? Both hemispheres of the brain turn on. And so the person who is in an intense level of an inappropriate stress state, when they get in that car accident, you're right, their history is going to result in more consistent, explosive, intense symptoms that are going to be very difficult for them to get out of. And the other guy who's been an athlete his whole life, moves his body regularly, has the same exact accident, he's in an inappropriate stress state, but he's only in there, he's locked in to a lighter stress load, then he's going to have less symptoms.
Okay. Yeah. All right. So I'll agree a couple of the things. The hemisphere turned on, turn off. I'm that's more metaphoric, but that's not really what happened. So I want to make sure people don't think that their hemisphere is turned off. So I talk about it from a different perspective, but I think we can get some clarity there. We all have a certain threshold for how much stress we can put on our physiology before it causes the body to have to adapt. We have two operating modes. One's called homeostasis, where I have all the energy to do all the things I need to do. And there's another state called allostasis, where I can't create enough energy to do all the things I need to do. So I have to turn down the physiology to certain systems to take care of other systems. So we shift from, like we said before, from manufacturing to cell defense, or the more important thing. Now, stress in itself isn't always bad, right? And even we use these terms, eustress and distress, like distress is always bad and eustress is always good. I don't know if I agree with all of that, because we can have a negative stressor on our physiology. And if we recover from it and overcome from it, it can be a huge learning experience and make us stronger and more adaptable. And we can have a lot of what seem like stresses, good stresses, that if we do it for too long, too hard, it becomes problematic. You kind of use is exercising good? Yes, we would call that eustress. Is excessive exercise can become a problem. We see a lot of athletes who look fantastic, but are terribly unhealthy because that eustress become excessive. And it's not about the stress itself, because two people can experience the same stress and have totally different experiences. And I think this is where what you're getting at is we also have a threshold. Everybody has that threshold before they shift from homeostasis to allostasis. And if you have stress, but get good recovery, you're back to baseline again. But if you're going through, and if you have an acute stress, you can have a really intense acute stress that pushes you up to right to the edge of your threshold, and you can come back down and your body adapts really well. But if your starting point for the day, let's say, is 3/4 of the way to your threshold, and you have the same acute stress, you're into danger physiology.
Yep.
And so now you change your operating mode. You could have one person have a massive amount of stress, and everybody agreed that is a massive stress. That should have created change, but she adapts fine. And then somebody else, we'd say, all somebody did was say no to them and they lost their stuff. How could that be? Well, because they're already beyond their threshold, or they're floating in that threshold. And I would agree with something you said earlier. I think a lot of us are floating just in and out of that threshold all the time. Some of us are stuck in danger physiology, and it becomes where you called it, I'm not sure if you said ignorance. Stress ignorance. But it's Tuesday. This is what every Tuesday's like. This is the norm, right? So I think we've got people walking around that don't know what a low stress response or homeostasis actually is. They're operating so often at the borderline or in that chronic maladaptive state that they consider that's the norm. This is how I always am.
Yeah, and when it becomes the norm, here's the challenge for most humans that are stuck in stress ignorance. Their parents had the same symptoms. Okay, so, well, guess what? Their dad was also an alcoholic. Their mom also binged on sugar when she was locked into her inappropriate stress state. And so then people start making excuses for the things that they're having, right? And they're choosing to stay in a protective mode and not reach out and ask for help or not investigate. I mean, it's not until recently. I mean, thank goodness for the internet, right? Because people who were of a lower class of education, right, they weren't able to investigate thoroughly why I'm locked into this inappropriate stress state and dealing with these symptoms. And so because you're willing to investigate even deeper than most humans are ever willing to go, people have access to people like you and have access to people like me, where now they can begin to understand what is the underlying cause of the symptom that they're dealing with. Most people, they only want to deal with the branch. They never want to deal with the root, right? Because with the root, it's easy to reach up and grab the branch, right? It's super, super easy. Oh, guess what? Oh, I can see. So what they do is they say, okay, well, let's just cut off the edge of the branch, right? Rather than looking at that root-based inappropriate stress state that they're locked into. And when I measure someone's stress state, I measure them by how far their feet are out, right? Some people, guess what? They're 1/8 of an inch. Some people are 1/2 inch. Some people are 3/4. Some people are 1 3/4. So when one leg is that much longer than the others, because one hemisphere is operating differently electrically, okay, it creates a stress on the body. And the moment you pull people out of the inappropriate stress state, guess what happens? They can actually hear what you're talking about. And so when you have stress ignorance, it's very difficult to wake that person up unless they have a symptom unless the symptom is so intense, they won't change their pattern of living.
Yes, I agree with that.
Yes.
For some people, other people will continue to just go through the struggle. So let me make sure I understand from your perspective. You're saying that stress, it could be physical, chemical, emotional, whatever, you're seeing, what you're looking at is the physical manifestation of that in changes in the fascia, or the tug in the pool, or the tightness of the structural system, the musculoskeletal system. And that's your window to say, hey, this is a person that potentially has some type of adaptive stress response.
That's right. Yeah, perfect. Yep. The adaptive stress response means that one side of the body is going to be more passive and more weak, and the other side of the body is going to be strong and tense. Okay. And so electrically, half the right side of the brain is going to impact the left side of the body. The left hemisphere of the brain is going to impact the right side of the body. And so it's very easy to see when you lay a person down how deep they are locked into an inappropriate stress state. And then the key is, how do I get them out, right? How do I create a strong pattern interrupt so that they can begin to have a different life experience?
Okay, so I think one of the things you kind of talked about is this stress ignorance. I think part of that is we've educated people that chronic health problems are normal, right?
Yeah.
You have reflux. You have a reflux disorder. You need this medication. You have this. You need this drug. That it is the things that they experience. These aren't abnormal things. These are everybody gets these things. These are the norms, right? We're not teaching people that hey, reflux, there's a reason for it other than a lack of proton pump inhibitors, or that everybody can get high blood pressure, and high blood pressure is the thing we need to treat. We've actually changed, since it's hard to figure out what's causing the problem, we've just changed the target. And we say that, oh, we have to treat your thyroid, we have to treat your blood pressure, we have to treat your whatever, because we got a tool for that. And we've moved from, oh, what caused it, to we're managing and treating the outcome. So how would somebody who's got chronic health issues, chronic pain, whatever, how are they going for themselves to determine, could what's going on with me just be that I hurt my hip and it hurts, or is it something deeper? Is it a maladaptive stress response or adaptive stress response? How does somebody differentiate that on their own?
No, it's easy, right? If you had blunt force trauma, then of course you have a response to that. But if you're in that maladaptive stress response, it took you time to get there. So if I'm going along with my life and I don't have some form of blunt force trauma, then it has to be maladaptive because it took time to get there. I don't have a reason logically. I don't have an experiential target point where that thing showed up, right? Like if you tripped down the stairs, okay, because you weren't paying attention, you're on your cell phone, and you hit your jaw very hard on the bottom step, well, of course you have jaw pain. But if you don't have anything like that, and then you wake up and you have unrelenting jaw pain, well, it has to be maladaptive stress response.
Okay, well, somebody could say, well, I didn't have any trauma, but I have arthritis in my hip. That's what's causing the pain.
Yes, but again, it would take you time in order to get to that space, right? And if you didn't have pain, for anyone who's listening, if you didn't have pain, there was a point, the pain that you're dealing with now, there was a point where there was no pain, right? And so then the question always has to be, well, was this always this way for you? Like, was it this way when you're in high school? Was it this way in grade school? Was it this way in kindergarten? No, I didn't have that then. Well, when did it show up? Oh, it showed up 2 days ago. Okay, and how old are you? Oh, well, I'm 56. Well, what have you been doing for 56 years to create this? And that's my first question. What have you been doing for 56 years to create this? I don't know. Well, let's investigate. What just happens to be that Mrs. Johnson has been sitting down as a secretary for 12 hours a day in the same position with her right leg crossed over her left leg. And that's her favorite position to sit in all day long. Well, of course, the structural body can only handle that position for so much time Well, she's been at it for, at least 22 years as a professional, same position every day, 12 hours. There must always be a cause.
Yep.
Somebody must be doing something, unless there's a history, and the history of the family is also the cause, right? If my mom dealt with her stress through eating massive amounts of sugar because it was very difficult to figure out how to communicate on her own benefit. Well, guess what's going to happen? The daughter grows up in a household. She sees that strategy, right? And because she was raised in that environment, she applies the same strategy, right? So I always point people to look at, well, what was your winning strategy for life? And then what negative stress management tools do you choose to use on a daily basis, right? And guess what happens? After I do the investigation, I figure out what their main strategy is for winning at life. And then I find out what their main daily drug is that they're addicted to. And as soon as they start to reduce, and well, first, once they understand, then they have their aha moment, like, oh my goodness. And then I ask them, did your mom or dad use the same strategies? Oh, 1000%. How about your grandma? Did she use the same strategies? Oh, yep, of course she did. So when I look at when someone who's suffering from some debilitating level of pain, and we talked about this earlier, whether it's physiological, whether it's maladaptive, whether it's psychological or emotional or structural, there's always a cause, right? If you investigate their history of their family, you're going to find out that they chose to use some type of stress management tool, whether it was positive or negative. We happen to be in this time in history where we use positive stress management tools. What would that be? Breath work, practicing painful honesty, communicating clearly. What does it mean to be a good leader? People are doing yoga. People are doing all kinds of positive things to deal with their daily accumulated stress load, right? But when you talk about the maladaptive stress state that people get into, the conversation or the language that I use is their lifetime accumulated stress load. But what's their lifetime accumulated stress load made up of? Their environment that they were raised in, their epigenetic and genetic predisposition, plus all of the daily accumulated stress that was never resolved by their restore, repair, and recovery rate, their sleep. And as that gets piled on day after day, week after week, month after month, year after year of over adapting, right? Stress response, guess what's going to happen? You're going to end up with intermittent and chronic discomfort in some fashion.
Oh yeah, listen, I agree with you. I mean, my background as a chiropractor, right? What did we, hey, we're always looking for what created this, right? In functional medicine, we're always saying, okay, what is it, right? How did we get here? And one of the most important pieces of somebody's intake process is looking at their health timeline, their story. How did we get from start to here? Because that often tells us this kind of the same idea. What are the accumulation of stressors that got us to the point that we're operating from this cell stress, cell danger response? So we're having the same discussion, just kind of using some different terminology. But I talk about this all the time. People think, well, I just got Hashimoto's autoimmune condition in my 40s. Okay, it didn't happen yesterday. That's when you got diagnosed. Let's go back and look at your health history and start working our way backwards to figure out how this got here. Oh, you were C-section, not vaginally born. Mom wasn't healthy to begin with. Lots of antibiotics as a child. Like, you can start to see how we got to this point where it's a big enough problem where, hey, I need to do something about it. I joke that, people, I think there was a famous philosopher named Donkey who says to Shrek, ogres are like onions, you have to peel back the layers, right? But that's how chronic health issues are. We have to peel back your layers. What we want to often address is the thing that's bugging us in the moment, or the thing that is diagnosed in the moment, and we latch on to that as the thing that's the problem. But that's the manifestation of days, weeks, months, years of accumulated stress that becomes chronic. And so for the listener, acute stress could cause you to have chronic health issues, but oftentimes this sneaky stress that creates the problem is what Christopher's talking about, is this low-grade cumulative stress without recovery, which is why when you cheat sleep, you can't recover, right? You really never get out of, you never get back to baseline, right?
Yep. You never get out of the stress response. In fact, you feed the stress response. And then what happens is your nervous system begins to identify that as you.
Right.
And
that becomes the new norm.
Yeah,
right?
This is the new norm. And so the question for me always is, well, how do I create a successful pattern interrupt in the patterns that are going? And so the first thing that I do is I get people to list out their daily drugs that they're addicted to. Mm-hmm. I call those negative stress management tools, right? People are going to use what's available to them in their environment, right? So if I go into a poor neighborhood in Peru, right? People aren't getting up and putting on their running shoes and putting on their gym equipment and going to the gym. They're getting up, and the guys are up at 5:30 and they're working in the fields until 7:30 at night, hunched over in these very strange positions. Okay. And they might be able to stand up for 2 or 3 seconds, but they need to go back down because they need to keep producing. Right. And so they're going to use negative stress management tools. After that day is over and that guy's back hurts, you know what he's going to do? He's going to grab a beer. He's going to grab a shot of tequila. Okay. He's going to make a mojito. He's going to make a mojito. And he's going to do what? He's going to down a few of those until he or she feels numbed out. And then they're going to go to sleep. They're going to get up. They're going to do it all over again. And their body's doing everything that it can. And I like the words that you use, adapt to the environment that this guy or gal constantly lives in. Mm-hmm. And then eventually one day that guy's going to bend over and he's going to get up, and his pain is going to be too big for him to ignore. And it's going to be too strong to be numbed out by the alcohol. And hopefully he or she has someone in their life that could say, hey, go listen to this podcast or go read this book. The challenge is these poor guys that are living in these poor neighborhoods, they're not educated, right? And so they're forced by the environment that they live in to be stuck in stress ignorance. And they're going to use caffeine, nicotine, alcohol, pharmaceutical drugs, recreational drugs, marijuana, or excessive exercise, or whatever they're going to use. They're going to be using that as a negative stress management tool to deal with their daily accumulated stress load, plus their lifetime accumulated stress load that has them locked into that maladaptive stress response.
So let's use your dude in Peru, right? And say, all right, you're assessing, you're saying, hey, how we got here is accumulation of stress. This day in, day out pattern of work creates imbalances in the musculoskeletal system that puts you in this position that creates discomfort. But instead of addressing and spending time working on the imbalance, you're reaching for the drug, the toxin, to help offset that discomfort, which then creates another problem, because now I'm drinking too much alcohol. It's toxic to my system and it's creating inflammation and leading to more body fat, and more body fat's leading to more inflammation. It's upregulating the immune system, and it becomes this vicious downward spiral.
Yeah.
How do we get, from your perspective, you're using this eccentric, concentric muscle activation to help change some of that structural perspective. And I'm going to let you explain it. So that might be the tool to change what we see physically, right? But how do we get that person to change? Because I always say, your state of health is really the accumulation of habits and behaviors over time, right?
Yeah.
If I don't expect anybody to be perfect, right? But if the vast majority of things you do are really good habits and you have a few bad behaviors, you're probably going to be pretty healthy. But that's not what we have. We have people with a lot of bad habits and a few good behaviors and then wonder why they're not healthy. So how do we get this farm worker in Peru who has to work all day, who has to be bent over day, to change his habits, his patterning? You can you can use the technique, but how do we change the habits and behaviors? So can you answer both of those?
Yeah. This is fun. So the first thing and the most important thing is education, right? Because without education, it's going to be difficult for them to make a different choice, right? Because they don't have the information, right? And I always explain things in a way that a 5-year-old could understand. And so I shift my language to wherever they're at, and then I choose metaphors and analogies, right, that make sense for what they already do, right? So if I'm talking to a farm worker, I use farming metaphors and analogies, right? I meet the person where they're at. If they're highly educated, if they're a PhD or they're an MD or they're a chiropractor, I speak their language, right? So the first thing and the most important thing is meeting the person where they're at verbally, which makes them feel safe, right? And I start to build rapport with that person, because when I build rapport and I start meeting them where they're at, they're going to feel safe, they're going to feel comfortable, and they're going to trust me, and they're going to take a risk, right? It's a big risk for a farm worker who uses alcohol to manage their stress to take on the idea that the alcohol and the work that he's doing is what's creating the pain, right? Because his father was a farmer, and his grandfather before him was a farmer. So there's professional pride, right, in what he does. There's all these other social loyalties that are happening to the person's position. So what do I have to do? I have to build rapport. I have to meet them where they're at. And if I can be successful at meeting them where they're at and using humor, using, again, metaphors and analogies and examples from my own life, if I'm willing to open up my treasure chest and go, look, I was suffering too. I understand the pain that you're in. And over time, let me share with you what has worked for me at a personal level. Now the trust is in place. And once the trust is in place, they're able to take a risk. And the risk for them is to do something that they've never done. You're asking someone to do something and to take on a belief system that's the opposite to their belief system. The only reason why they're willing to do it is because they're locked into insufferable pain. And then you have the perfect moment, right? They're in insufferable pain. Their wife has been telling them for 3 years, because guys on their own usually don't go and get this done. If I see a male that's in his 40s and 50s, it's because his wife sent him over.
I don't find that hard to believe.
Okay. And so I have to break through these emotional, but also these social constructs, right? And now we got the rapport. Now he's willing to listen. And then I have to have something that, one, I'm able to teach him, because I don't believe in codependent dependent relationships. And the only way for me to empower the person is to teach them what I did to myself so that they have something that they can do, right? It's like if you bring someone who's addicted to heroin into a treatment center, you got to give them another drug or they're not going to stay. So if you don't give them methadone, right, when you turn your head to the left, they're going to walk out the back door, right? So I have to give them something. And so I teach them how to use concentric, isometric, and concentric contraction in very specific positions to remove a massive amount of tension in a short amount of time with very little effort. Okay.
Mhm.
And in the process of walking them through that, I've empowered them. And because I make them do it to themselves, they then go, oh, I did this and my pain, my discomfort, it decreased. Or the opposite is, oh, not the opposite, but I did this and now I woke up the next day and I had twice as much energy. Or I did this and I woke up the next day and my foggy mind was extremely clear. So if I can get them to produce a sufficient enough result that is what they're wanting to experience, they're going to listen to me. I have to have a win. And my win is to get them out of the chronic maladaptive stress state, or what I call the inappropriate stress state, to get them out of the state that they're locked into. And now as they apply that on a daily basis, right? Guess what's going to happen? Every day the symptoms are going to shrink, and it's going to shrink, and it's going to shrink more. And then eventually they don't have it anymore.
All right.
And now they're empowered. And because they're empowered, if it starts to creep back in even a little bit, they go, oh, I know exactly what I need to do.
Okay, but that's that's great if the adaptive, the neuromuscular adaptation is the effect, or no, if that's the cause, right? If that is the initial cause and they've been in this maladaptive state, but what if the issue is caused by something else? And the physical manifestation of the neuromuscular manifestation that you see that's generating pain is caused by their subconscious beliefs about their spouse.
No, this is great. This is
because because then somebody could say, hey, you're just giving them a solution for the outcome, but the real cause, it's what's going on subconsciously that they're maybe, or consciously that they're aware or not aware of, that emotional stress is creating the physical manifestation.
Well, this is wonderful because the emotional stress that they have creates a physical imprint, right? And so as I continue to think a thought over and over and over again, I create what's called a belief. And then once I lock into that belief, my body then adapts to the beliefs that I create. And so as I change the body, I automatically change the beliefs. And so sub, which means below, right? Below conscious. So I think of the conscious mind as analysis, right? The observer. And then the unconscious for me is controlled by the breath. The subconscious for me in my work is everything that's below the neck, right? Sub, below. And then I think of the superconscious as everything that's involved in the energy that runs around the body. And so because I understand where certain behaviors and belief systems get locked into, what parts of body they get locked into, as the person reduces that level of tension and stress, it all automatically breaks that cycle of thought. And so some people that come to me, they have an overactive mind, right? Or they're or they have debilitating states of anxiety. As soon as I pull their body out of that stress state, guess what happens? They have a massive reduction in the overactivity in their mind. They have a massive reduction in their anxiety levels. Now they're perceiving reality differently. And because their perception is different, they no longer manifest stress and tension and distortion in the same fashion.
Okay.
And so going into the body is what creates that, with powerful levers, creates that immediate change in perspective. Their breath, the way they're breathing changes, the way they're perceiving, the overactivity shifts, the anxiety reduces. And now when their wife says, hey, I think we should go here for vacation instead of responding to her internally as, why is she always telling me what we're going to do? They go, you know what? That sounds like a good idea. Because now they're pulled out of the protective mode And now they're in a state of receptivity, right? They're in a flow state. So when you're locked into an inappropriate stress state, you have to have a body that has a massive amount of tension, which then creates not only structural distortion, it then creates emotional distortion, because emotional distortion is relative to structural distortion. You change the body, you change the life. Whatever's in your body is in your life. If you have something in your life that isn't working financially, energetically, in terms of your interpersonal romantic relationships, there's always a place in your body that's helping to co-create that, right? Because we live on a third dimensional plane of existence. In this plane, we have projection, reflection, manifestation, and generation, right? So we're generating our own problems, and then we project those beliefs into the world that then get reflected to us externally through the way that the world around us responds, and internally.
Yeah, I agree with those ideas and comments. But let's go back to something. Let me make sure I got this making clarity for the listeners. You started in the beginning. If you've got a bad relationship with your father, you're going to have to fix that relationship, right?
Sure.
But
you have to attain some level of neutrality. Without neutrality, you have vested interest.
Okay. So if that's the real issue, my bad relationship with my father, right? And it's manifesting as physical pain. And you're helping me with that physical pain and establishing and changing the neuromuscular physiology, right? To make that mechanical strain go down. So now my pain goes away. Are you saying that now, don't I still have to address the relationship with my father? Or are you saying I still have to do it, but I'm probably in a better position to deal with the stress?
Yeah, for sure.
Or to deal with the situation? Because I just want to make sure maybe I am confusing what you're saying. Like, hey, if I do this and I change the physical component, you won't have a problem with your father anymore because I removed the physical component. It was the physical component that was maintaining the problem you were having with your father.
Yeah, so let's look at that in terms of electromagnetics, right? So all humans are made up of what? Electromagnetic energy, right? And so then that means we have electromagnetic energy to do what? We're magnetic because magnets attract. Well, whatever's going on in my body is going on in my nervous system. Whatever's going on in my nervous system is going on in my brain. Whatever's going on in my brain, in my body, and in my nervous system is being fed into my auric field, right? My auric field is made up of electromagnetic energy. They call it an aura. When I shift and reduce a massive amount of stress, tension, and distortion, right? And when I get out of that inappropriate stress state, what you would call that maladaptive stress state, when I get out of that, now my auric field has changed. And now I shift into the receptive mode instead of the protective mode. When I'm in the protective mode, I'm in vested interest. What does that mean? That means things need to look this way, sound this way, and be this way in order for me to be okay emotionally. So if my father raised his voice every night when he came home from work, and I had to walk on eggshells around him, when I'm in a room with men who have very loud voices and speak loud, it automatically pushes me back into that stress state, and I start to get locked into holding more tension and stress, right? When I'm in that environment. Well, if I go in and I remove the physical imprint, guess what happens, right? I now am at choice on how I want to respond to that because I'm in a state of neutrality, right? In neutrality, I add nothing, I take nothing away, I simply see things for what they are. Wow, this guy speaks loud. Otherwise, what happens is this guy's loud voice has control over how I'm going to respond emotionally. So what choices do I have? Guess what? There's a lot of people out there that do chiropractic care. You have massage therapists out there. You have people that are willing to go into the body. They have a lot of mastery, and they can start to reduce the distortion that was created at a physiological, a structural, an emotional, an energetic, and a psychological level by simply reducing the amount of tension that's in the body. Right? When you look at children, all children want is love. That's it. They want love, affection, and attention, and a safe, spacious environment. And what I loved about what you said earlier is you said, well, what happens when someone gets yelled at, right? Well, when you're a 2.5-year-old child, you're crawling across the floor, reaching for the shiny vase. Your mom out of the corner of your eye sees you that you're going to hurt yourself. She yells, "Butch, honey, turn around." And the child then starts crying. You see it. You can see it all the time. Parent yells, a child cries, right? They're informing the parent what? That you just created a negative stress response for me. You interrupted my ability to investigate my environment. The mom is thinking, this is to my child's benefit. I don't want them to get helped. But now that child is going to do everything that it can to do what? To avoid punishment, rejection, humiliation, violence, discomfort, and pain. And they create a winning strategy. The challenge is this. That's happening at a precognitive state where children have irrational minds. So they're making up things about reality that are completely false. And all we need to do is have someone arrive at our doorstep that's in pain, and we know they created irrational thoughts about reality that their subconscious is continuing to project into the collective field, that you're creating a maladaptive stress response. So how do I break the pattern? How do I get in and create a pattern interrupt? Well, if what we have all the way to the left is an event, okay, and that event then causes me to avoid punishment, rejection, humiliation, violence, discomfort, and pain, guess what? Children around the world right now, a few weeks ago, were thinking, 7, 8, 9-year-old kids, 6-year-old kids were thinking there's a fat man in a red and white suit that's going to come down a chimney. We don't even have a chimney in our house. He's going to eat mama's cookies. He's going to drink her milk and lay presents under the tree. Children have irrational minds. And so we know this is true. Okay. Go around and ask any 5-year-old at a toy store if there's something called Santa Claus. A 5-year-old believes that's real. A 5-year-old also believes when daddy raises his voice at mommy and she gets into a stress response, that mommy could die. Because see, we're looking at things from the adult perspective. You got to look at things. How would a child be looking at reality when you have a father who's a violent alcoholic? How would a child be looking at reality when you have a mother who's obsessive, compulsive, and punishing with her language and her tone? Well, guess what? If you were raised in an environment that was unsafe for you to explore, you have created strategies in order to avoid punishment, rejection, humiliation, violence, discomfort, and pain. The challenge is the 45-year-old guy who's coming to see you, he has strategies. The question is, how do you determine what those strategies are? Well, guess what? Wherever he's having the pain in his body, he's already telling you what his strategy is. Because the body is forced to always tell the truth. The mind will lie 1,000 lies because the mind's job, the brain's job, is to keep you safe. But the body's job is to always tell the truth. So as a listener, right, as a professional, if you're listening, your patients' bodies are informing you of what their strategies are. And the question is, how do you interrupt their thought process that is helping to co-create this inappropriate stress response that you call a maladaptive stress response? How do you interrupt that pattern? You have to go into the body because the body has the greatest amount of force.
So you're saying the thought process is creating the physical manifestation. And if I need to change the thought process, I need to change it from a physical perspective.
Yeah, I need to go into the body in some way, either detoxify, right? Or I need to go in and remove something that is inorganic to our nature. Like when I look at our nature, I'm looking at a balanced human. What's inorganic to a balanced human's body? Anxiety. What's inorganic to a balanced human's body? Pain. What's inorganic? Fear. What's inorganic? Self-righteous positions. What's inorganic? Hate and anger. What is organic is excitement versus anxiety, confidence versus fear, righteous behavior versus self-righteous behavior, and comfort versus discomfort. That's a balanced, neutral state of function. When a person has been under strain for a long time, under a stress load for a long time, in a maladaptive stress response for a long time, they are going to one day get a symptom that's unrelenting, and hopefully they find somebody like you, and they find somebody like me, or they find somebody that's one of the professionals on this call that can help them create a successful pattern interrupt, so their body, brain, and nervous system can inform them, hey, guess what? That thing that you're fearing, that thing that you're scared of, there's no need to fear it or be scared of it. Actually, when you get to that crossroad, instead of always turning left, you now have the opportunity to turn right.
Yeah, I guess, listen, I agree with a bunch of the stuff. I think maybe things I question when you talk about organic, inorganic, normal, abnormal. I think to have pain is not necessarily an abnormal occurrence. I mean, it's a normal,
meaning it's inorganic to a balanced human is what the response was, right? An imbalanced human, that's a normal state of function. A normal state of function is to have pain for someone who's out of balance, right? Because everything is relative and reflective. Whatever's going on in my outer story has a direct impact on my inner circumstances. My inner circumstances, my biology, my physiology, my structural health, my mental wellness, my emotional wellness, my psychological wellness have a direct and reflective impact on my outer life. So I'm speaking from a position of neutrality. For a person who's in neutrality, pain is inorganic to them. They don't experience pain. Okay. For a person who's in a balanced state of function, they communicate clearly about their desires, wants, and needs. They are open-minded. They are generous. They are honest. They are passionate. They are unconditionally loving. They are forgiving. They have the ability to set clear, defined boundaries. They are sober and eat high quality food. They make quality decisions. They can problem solve instantly, and they're deeply understanding, and they're constantly humorous, right? So those are high functional states of behavior.
Mm-hmm.
What we're having, the reason why I'm bringing up that aspect of the conversation is so that anyone who's listening in could go, oh, you mean attaining a state of neutrality at a physical, physiological, structural, psychological, emotional, energetic level is possible? Yes, it's totally possible, because as long as someone knows that that state is possible, they're willing to investigate and they're willing to do the work necessary in order to get there. But if they don't know that that's possible, okay, they're okay with suffering needlessly and staying in a state of stress ignorance.
Yeah, I agree with I agree with those pieces, and I talk about raising your level of fitness in your emotional fitness, your physical fitness, your chemical fitness, your diet, nutritional fitness, right? Your sleep fitness, your respiratory fitness. I think you're talking about the same thing. As hey, as I raise my level of competency in these areas, I get to a higher state of health, a higher state of neutrality, or however you want to define it. But those are constant things. And the biggest challenge I think we have as a society is we look around and we consider what we're experiencing the norm, because everybody else is, it's, hey, he has the same thing, he has the same thing, so this is the norm. And we think that that's as good as it gets because the people around me are, or this is how I am every day. But those people who are active and engaged in trying to improve their level of health realize that there's always something better, right? There's always another level to get to. You train, exercise, you go, man, I this is as much as I can lift. But if you keep at it and keep training, you go, oh man, I can lift more, right? I can only run 5K. Well, let's keep training. Oh man, you know what? I pushed harder. Now I can run 10 miles, like 10K, right? So we often are in a state of ignorance of, we don't know that what's possible, what's achievable, because we're kind of stuck in our stuff, and our environment reinforces our limiting beliefs, right? And so I think there's a lot of points that we talk about. We just talk about it from a different perspective and a different angle, but I think the general philosophy of what we're trying to talk about is very similar. And so I want to kind of bring this home a little bit, because I got to jump on another call. If people want to learn more about you, where do they go?
They go to truebodyintelligence.com, and they can read and go around the site, get a little bit of information to themselves. But if there's somebody who they're very serious about wanting to upgrade and get into a state of neutrality and put balance back in their life, physically, mentally, emotionally, spiritually, energetically, then you email me from the website at support@truebodyintelligence.com. And then my assistant, she'll send you a one sheet, and you take the steps necessary for us to get on a call, and we'll have a conversation. Awesome. They could order my book off of Amazon, Free for Life, a U.S. Navy SEAL's Path to Inner Freedom and Outer Peace. And they can get a high level education, because without the education and without being informed, it's impossible for you to make a really good decision to your own benefit, right? And my thing is to inspire people to take heartfelt action to their own benefit and the benefit of those in their family and their community.
Awesome. Hey, Chris, an hour and a half went by really quick. It was a good conversation. I appreciate you coming on. For the listeners, go back and listen to this one a couple times. I mean, I think there's a lot of deep thought going on here. And even though it might seem like at times we weren't in agreement, I think Christopher and I are in agreement on a lot of these points. And that stress, whether it's physical, chemical, emotional, microbial, changes our physiology. And sometimes we can see that manifest as physical issues, and many of the issues that we complain about, my gut, my thyroid, my shoulder, my neck, my whatever discomfort, pain, or disorder we experience, is often the result of poorly managed stress response. We're stuck in that cell danger physiology, and it becomes the norm. So Chris, thanks a lot. I'm going to jump on to another podcast, but I appreciate you coming on, and maybe we'll do this again. Okay.
You're doing with everyone.
All right.
It's important. We need people like you.
Thanks. All right, Chris, take care, and maybe we'll chat again soon. Okay.
Okay.
Take care.
Take care.